Okay, so tell us who you are and what we're here to talk about today.
Well, my name is Mark Jefferson. I'm the Manager of Infection Prevention and Control at Hamilton Health Sciences. And today we're going to talk about moment one for hand hygiene. Moment one is when staff do hand hygiene before touching the patient or touching their environment. There's 4 moments for hand hygiene in healthcare, and moment one is often considered the most important of those 4 moments.
So explain to me, why is it the most important?
We in the hospital are exposed to all kinds of different germs that patients bring in and that are in the environment, and moment one, performing hand hygiene at moment one, helps us prevent bringing those germs that might be harmful to some of our patients into their environment and potentially giving it to them and causing an infection. So some common examples of how we would do moment one hand hygiene is ensuring that we're not wearing gloves between patients from patient to patient, and making sure that we're either cleaning our hands with soap and water before touching a patient or their direct care environment, or using an alcohol-based hand rub before touching the patient or their environment.
We don't want anyone to have a hospital-acquired infection, and we certainly know the negative outcomes associated with that. When did we realize here that we wanted to improve our performance? Take me back in time a little bit.
So starting in 2021, we saw a little bit of a creep downwards in our moment one hand hygiene rate, and then we saw them kind of bottom out in May of 2023, and at that point the board identified that this was something that we really needed to focus on as a corporation.
So walk me through the plan. So what did we do to tackle this issue?
So we put our continuous quality improvement tools to use. So we performed an A3. We started with doing a root cause analysis, looking at what the foundational issues were. We did some walkabouts on the unit so that leaders could see what issues staff were actually facing and the barriers that were in place. And then using the data that we collected from those problem-solving tools, we started to identify the gap, or address the gaps that were identified, working with staff to develop unit-specific tools as well as more tools for more broad use across the corporation.
How important was the connection with our frontline staff in this work?
The connection with frontline staff was super important. It helped to ensure that they were aware of what the actual issue was, and it also helped ensure that they were engaged in doing some of the problem-solving work and coming up with solutions for the issue.
Okay, we're going to move on to fun questions. Okay, if Hollywood made an action movie about hand hygiene, who would play the villain?
I wish Alan Richter was still alive because
Alan
I could
Rickman?
see
Yes.
Alan Rickman.
Yeah, I love
Sorry,
him.
Alan
Yeah.
Rickman was still alive because I could see him playing the villain. I love him.
So Alan Rickman is a phenomenal villain.
Obviously.
Okay, this question I am no expert to ask, but I'll ask it anyway. If germs glowed neon when you didn't wash your hands, what part of the hospital would look like a rave? And I have never been to a rave. I have no idea what a rave looks like. I'm assuming it means what are the high-risk areas of the hospital that would show up that we'd have to be paying attention to.
Anywhere inside of a patient's environment where patients are spending the most time, constantly shedding skin cells that have germs on them, lots of people touching the environment, touching the patient, that would probably be the most contaminated area in the hospital.
Okay, I know we're very proud of the results, so tell me what the results of this effort have been.
So we saw our rates go from their low up to 85%, which is the target that the corporation set in really a very short amount of time. And since we hit that target, we've managed to maintain it for this fiscal year. So some really good, quick improvement work that was done, as well as some good sustaining work that's been done as well.
Thank you so much, Mark. It's been wonderful chatting with you. Thanks for all the work that you do, and thank you so much to all of our teams in infection control and throughout all of our hospitals.